Assalamu alaikum, Brother Ali Mehdi.
Wa alaikum assalam. Okay.
Thanks for joining us today.
Thanks for the invite.
Could you please introduce yourself and your occupation?
Yes, my name is Mehdi Razvi, and I've been working in the sleep medicine for the last 20 years almost now. And my profession is called polysomnography. I'm a registered polysomnography technician. And what this means is that I monitor people's brain waves and their heart and their muscle movements and their breathing patterns and their everything from their snoring, anything and everything that affects someone's sleep. We study that, and we want to see what the quality and the quantity of someone's sleep is like. And we make a report just like you would have a blood test, you would have a sleep test, and we can do that test and give that report to a doctor, a qualifying doctor, who can then treat the patient for that underlying sleep issue.
Why exactly does our body require sleep?
The scientists have been studying this for a while now. Their main reason that we sleep, all mammals, for instance, is the maintenance that is required in the body. We can't constantly run any machine or anything constantly all the time. There are some instances if we slow things down, it's easier for the body to do maintenance. That's what the consensus is now, is that we absolutely need sleep in order for our bodies to rest and recover and get ready for the next day. All the healing, majority of the healing in the body happens at night.
What are some factors that affect the quality of sleep?
There are a lot of physiological factors, but there are a lot of social factors. Sometimes we are going through, let's say we have pain, any reason. You might be going through some disease, you got into an accident, something happens, and that pain is causing you to stay awake. Sometimes it is some stimulants that we have in our body. It could be in the shape of a lot of caffeine, too much chai. It could be a shape of a lot of nicotine. It could be a shape of a lot of alcohol, for instance. So there are a few chemicals that also affect and alter the state of our sleep. But the number one reason that we have found is stress. Is stress and the lack of the knowledge to manage that stress is what's keeping people from getting a good quality sleep. And of course, our habits. If you have to watch that midnight TV show every day, or your work schedule, it could be so many things, late night majalis, so we have some social events that prevent us from sleeping regularly. We have some physiological inside factors.
What are the different types of sleep cycles, and how does one determine which cycle is best for them?
For an adult, there are 4 cycles. There's stage 1, stage 2, 3, and then what's called REM. Stage 1 is where you're barely about to fall asleep, you're almost awake. And stage 2 is where you spend most of your night. And then there's stage 3. Stage 3 that is called deep sleep or restorative sleep. We need about 15 to 20% of the night we need to be in that stage in order for our body to do what it's supposed to be doing. And then of course we have the REM stage. REM is also extremely important. There's so many studies done in which people are prevented from going into a certain stage. You're sleeping and they're monitoring your brain waves, and they know exactly when you're about to go in stage 3, and they hit a buzzer and wake you up. They never let you go into that stage, and they see how that person operates the next day. So for instance, people who don't get enough REM sleep, enough dreaming, they can't recall things. They forget things. You might tell me your name, and 5 minutes later, I can't recall that name. Another reason why your teachers and elders have always told you to sleep well before an exam, it's not because they want you to be rested, it's because they want you to recall the things that you've learned. If you don't get that sleep, you might just blank out during the exam. You've read it, you just can't put your finger on it, you don't know. So it's extremely important that we get each and every stage.
Does everybody need 8 hours of sleep?
Not necessarily. Some people need more. Some people, teenagers for an example, they need a lot more than 8 hours. They need 9 to 10. Babies need even more than that. They're sleeping pretty much the whole day. The infants are sleeping pretty much the whole day. They wake up to feed and for a few things. But as we grow older, we need less and less sleep. Now, if sleep is associated with growth and sleep is associated with being restful, then yes, you do need that minimum amount of sleep that's required for you. Someone might wake up after 5 hours, feel rested. Someone might need 7 hours. Someone might need, how do you know though? How do you know how many hours I need? Well, how many times are you hitting that snooze button? Are you waking up fresh by yourself, or do you still need that snooze button? Now, sometimes it's okay to have an alarm to wake you up, but the best way to do is if you know you need 7 hours of sleep or 8 hours of sleep, that's when you feel best, and you have to wake up at 5, for instance, then you have to go back and sleep accordingly. It's best to sleep in 90-minute intervals. That's how our sleep cycle works. So as opposed to if you sleep for 6 hours, for instance, that's 4 sleep cycles, you'll feel good. But then if you want to sleep more than 6 hours, try to make it 7.5, because then you will complete that next sleep cycle also, and you will feel extremely rested after that. So see if you can, how many sleep cycles you need in a night to feel good, and then go from there. There's no set hours per se. Some people are able to function really good after 4 or 5 hours of sleep, and some people are not.
Is there any downside to oversleeping?
Oversleeping in the sense that if you're falling asleep when you're not supposed to be asleep, then yes, there's a big downside. Even Islamically, let's say I slept through Fajr or Zohar, any up until the namaz is qaza now, it's a big downside. We don't know the spiritual implications of that yet, but there's some things happening. Physically also, there are big downsides to oversleeping. We don't want to oversleep. You will find yourself, if you had ever passed out for too long, you wake up feeling so groggy. You might have even pulled a muscle in your neck because you slept awkwardly for too long, and now your muscles are pulling and in pain. Other than that, there are people who are falling asleep. They're falling asleep at inappropriate times. If you're falling asleep at work, that's not good. If you're falling asleep while you're driving, that's not good. Or while doing simple chores, there's a lot of downsides to oversleeping, and just as much as there is to not sleeping enough.
Is there any benefit to rigorously following a specific sleeping schedule?
Yes. Our body likes discipline. If there's a discipline, then you will feel healthy. If you ask some of the healthiest people around the world, they have a certain discipline. They wake up at a certain time, they go to sleep at a certain time, and they eat at a certain time. So we need to follow a schedule. If you look at if you Google sleep hygiene, how should I sleep, one of the recommendations in every single list is to keep a constant sleep schedule as much as possible. Keep that sleep schedule constant. Some people are really good at it, and some people are not. But those who are good at keeping a constant sleep schedule, if their body knows that 10 o'clock means sleep and 5 o'clock means waking up, your body can adjust and make sure that during those 6 hours, all the maintenance in your body is happening. All the stuff that needs to happen at night is happening during that 6 hours. If I train my brain into thinking, okay, well, I'll sleep until 8, but now I'm waking up at 4, a lot of the things that were supposed to happen will not happen now. I will wake up feeling tired, and it will show up in one way or the other in my health. So maintain your sleeping, maintaining a constant sleep schedule is extremely important.
What can we do to reduce the amount of sleep that our body requires?
Well, it's not easy. However, it's doable. If you know for sure that, okay, I can't sleep as much as I need, but does that mean you can't control your exercise schedules, your caffeine intakes, your cigarette smoking, your nutrition. Can you work on all of those to compensate for the lack of sleep that you think you need to do? If you are able to do all of that, then you can think about, okay, I think I will wake up fresh after sleeping for just 5 hours or 6 hours. I think I can do it. But the only way that 5 to 6 hours are going to be optimal for you is if you work on it all day long. You have to work really hard on that. Make sure you don't have stimulants in your body that will keep you from getting that deep sleep. You only have 5 hours of sleep now. So stay away from caffeine, stay away from nicotine, stay away from, I don't think I have to say this on this channel, but stay away from alcohol. Stay away from some of the things that stimulate you. Don't watch stressful news at night that will cause you to be in a very aroused state, in a very uneasy state. Learn how to do exercises that relax you. Breathing exercises, simple thing as sleeping with wudu, calms you down and gets you a better sleep.
In Islam, do we have any recommendations regarding the position, duration, and schedule of sleep?
The position that's recommended is to sleep on your right side. Of course, there are exceptions. If you have shoulder pain, if you have anything that prevents you from sleeping on the right side, then you can try sleeping on your left side or sleeping on your back. But in general, sleep on your right side. That's recommended. And as far as duration is concerned, like I said in my previous question, it depends on you. You need to be a productive individual in this day and age, and you need to, even concentrate on if you want to concentrate on your salah, even, and if you're half asleep, the Prophet never wanted that. He wanted. There were people who were hanging ropes in their house, in massages. They would hold on to the rope so they can pray longer because they were falling asleep, and the Prophet made them take the ropes off. It's like, no, go to sleep. Sleep, pray less, but pray. It's the quality that matters. So you need to figure out how many hours you need. 4 hours, 6 hours, but minimum I would say is 4 hours, and the maximum I would say you should be done in 8 hours. If you need more than 8 hours of sleep, then you're a very rare case. Islamically, we are there's also a mustahab act called the qaylula, sleeping in the afternoon. It's recommended that take a nap, and a nap is usually defined by a few minutes, not hours. 20 minutes, 30 minutes, that's a nap. If you're sleeping more than that, then yeah, you've just gone to sleep. You're not napping anymore, you are sleeping now. So sleeping maybe not the best thing, but taking a nap or two even is totally recommended after Zohrain, before Maghribain. During that time, take a little break, take a little nap.
What is sleep apnea, and what are its causes, effects, and cures?
Apnea means no air, without air. Now, as far as we are alive, we need to be breathing, we need oxygen. There are some people, they have an obstruction in their airway that prevents the air from getting down to the lungs. If you don't breathe properly, then you don't get the oxygen that's needed. You have to have oxygen. You're alive, you need oxygen, you need to breathe. People with sleep apnea, especially obstructive sleep apnea, there is an obstruction. Maybe you have really huge tonsils that at night when you're relaxed, they just fall back and block the airway, prevents you from sleeping. Maybe you have your tongue is really thick, and the weight of the tongue itself is enough. When you're asleep, it just slips back and blocks the airway. So many reasons can cause you to have sleep apnea. You're not breathing. If you're not breathing, you're not getting oxygen. If you're not getting oxygen, as soon as that blood with less oxygen in it reaches your brain, it triggers your brain to wake you up. You immediately wake up, and this cycle happens hundreds of times. Your sleep is disrupted, and you'll wake up feeling tired because your muscles, your body never got the oxygen that it needed. How do we fix that? Usually people associate sleep apnea with being overweight. If your neck, for a man, if it's more than 18 inches, there's a good chance you have sleep apnea. For a woman, it's 16 inches. If you just put a tape around and you measure, you have a a collar that's more than 18 inches, you should definitely get checked out. Now, let's say you go to a sleep lab, you tell your doctor, I'm feeling tired, I don't know what to do, I sleep so much, I'm falling asleep. The doctor will say, okay, fine, you're not feeling rested when you wake up, go to a sleep lab, get tested. When you go to a sleep lab, they will monitor your oxygen levels during the night and your breathing patterns, among other things. It'll clearly tell them that you spent so much amount of night with below normal levels of oxygen, and it was because you were not breathing. You simply go back to the sleep lab for one more night, and you try what's called the CPAP machine, a continuous positive airway pressure machine. It's just a machine like when you blow a balloon, the balloon gets big. That's what it tries to do to your airway. It blows in just a little bit of air, and your airway pops open, and it doesn't close on itself anymore. And just by doing that little simple act, sleeping with the machine, keeping your airway open, your sleep goes back to normal in literally a night or two. So it's a very easy fix. Some people might not tolerate the machine on their face. They might say, I need surgery, or I might need some alternative fixes. There are out there, but those are not guaranteed. CPAP pretty much always works for an obstructive apnea patient.
Having worked with patients in the community, are there any specific patterns and practices you have noticed that are harmful?
The number one thing that's harmful in our community, it's that our large consumption of caffeinated products. If it's not chai, then it's Coke. And we have a lot of events, especially during Muharram, especially during Ramadan and stuff, where we think that diet laws don't apply to us anymore. And we are literally sometimes neglecting our health due to our cultural norms, and they can be harmful. I don't want to say that going to a late night majlis is harmful per se. It probably has more benefits in the hereafter and in this world. However, you need to assess how much can you push yourself. Is this really the best option for you? Remember what I said back in the days when people would put ropes in the mosque and they want to do a long salah and they're falling asleep, and the Prophet said, no, don't do that, go to sleep. It's better that you go to sleep. I don't know if that applies to majalises and other stuff. If I'm at the majlis and I'm falling asleep and I haven't paid attention to what the Maulana said, it has not changed me one bit, it has not affected me one bit. Am I really there or am I not there? I might be getting lots of sawab for showing up, but is there a better alternative to getting more sawab and also getting the advantages of this? I think people need to assess that, and if you're not doing that, then at least compensate in another way. Your sleep is not good, but can you fix your nutrition? Your nutrition is not good, but can you fix your exercises during the day? If you're not doing any of that, then your health will definitely be affected. And Ramadan is coming, Muharram is coming. Prepare yourself. You ask yourself, okay, I'm going to fix my diet because I can't really control my sleep schedule, especially in the first 10 days. So I'm going to try to eat right. I'm going to exercise a little bit more. Let's do the other things at least that we can, in order for me to stay fresh, alert. When the Maulana says something, I can absorb it and I can use it. Maybe my matam is a little bit better when I'm alert too.
If you had to give one key piece of advice to the community regarding sleep, what would it be?
I would say it's sometimes for the adults it might be too late, but if you have kids in your house, make sure that they are starting off on the right path. Make sure you instill good values and good sleep hygiene in them, especially teenagers. They do need a lot of sleep. They're still growing. This is the last phase of actual growth, so don't ignore that. Make sure that they sleep on time, they wake up on time, and from there I think the next generation will fix themselves. Try to limit your caffeine intake. If you're going to sleep at 11 at night, don't drink any caffeine at 10:30. Stay away from chais and stuff like that at least 3 hours before bedtime, a minimum. If you can do more, then that's good, but keep away from stimulants, caffeine, nicotine, cigarettes and all that stuff before bedtime, and try to maintain a sleep schedule. If you can do that, then we'll all be more productive.
To reach out to Brother Ali Mehdi, check out his Link313 profile in the description below. This video is brought to you by Link313. To sign up for an account, visit link313.org and expand your communal network.